My name is Dr. Michael Lara, and I'd like to welcome you to today's webinar on Intermittent Fasting 101, everything you need to know to get started. Before I start, I'd like to just say a few words about my background and interest. As you know, I am a board-certified psychiatrist. I specialize in the treatment of many chronic diseases such as dementia, depression, and anxiety. And I'm also very interested in using nutritional or dietary techniques as an adjunct to traditional medical treatments. So many of my patients, for example, in addition to standard medical therapies such as medication or psychotherapy, will also follow a program that has very specific recommendations on dietary practices. I also give some specific advice about types of exercise and how exercise, aerobic exercise in particular, can be helpful for treating problems such as attention deficit disorder or depression. So my interest in intermittent fasting really came about through my own research and investigations into dietary strategies to improve brain function. An interesting phenomenon occurred, though, as I began researching intermittent fasting, and that was that in addition to improving brain function, I also noticed patients who are having remarkable changes in body composition, sometimes without even trying. So in many ways, it was more or less of a side effect that I noticed in patients, that they had better body composition, began to shed unwanted pounds, and in addition to having better brain function as manifested through thinking better, feeling better, and so on. So before I get started with the details of what intermittent fasting is, I just wanted to make a few disclaimers just for the purposes of understanding what I am suggesting and what I am not suggesting. So the information in this webinar is really for informational purposes only. I am not intending to diagnose or treat any specific medical problem, and if you decide to implement any of the information in this webinar, please discuss this with your doctor first. I do not have any financial affiliations with any of the products that I'm going to mention in this webinar. There are a couple of supplements that I'll mention later on. Just wanted to state up front that I do not have any financial interest in or affiliations with any of those products. So let's get started. Why, in the first place, did I decide to do a webinar on intermittent fasting? Well, a little background might be helpful. I recently completed a tour on a topic titled Food for Thought: How Nutrients Affect the Brain. And during this speaking tour, we visited 12 cities. There were a total of more than 3,000 participants at each of the, in total at this sites that I visited. And during the course of the seminar, I covered a number of nutritional strategies for improving brain function. Participants in the seminar learned, for example, how supplements like N-acetylcysteine, branched-chain amino acids, and coconut oil could help with brain function. So one of the bits of information that I gathered from visiting these various cities is that the participants were interested in certain topics I covered and not so interested in others. One of the most popular topics that we covered during the 6-hour seminar was something called intermittent fasting, which obviously is the title of this webinar. And intermittent fasting generated more questions than any other topic that I covered during the seminar. So I thought it would be a good idea to provide some additional information about intermittent fasting, as well as some more concrete information about how it works and how to implement it. When I began my research in intermittent fasting, I often not only read as many research articles as I can and gather as much information as I can, but I also, with my patients, begin implementing these strategies to see how well they work with my own eyes. And I wanted to start off by sharing a story with you of someone who I will call CM. CM's story exemplifies many of the outcomes that I've seen with other patients who have practiced intermittent fasting. So let me just give you a little background about CM. CM is a married mother of three children. She has a very busy job. She not only does she work full time, but she also is very involved in the care of her children. She is, without doubt, a hard worker and has a very busy life. Because of this, or in spite of this, she has struggled with weight gain for most of her life. At one point, she had put on close to 80 pounds, or was greater than 80 pounds above her desirable weight. Like many of us, she had tried numerous diets. She had tried, for example, the Atkins diet, which is a variant of a low carbohydrate diet. She had tried the Zone diet. She had tried, I believe she also had tried the South Beach diet, and a couple of others. The point was that despite the fact that she was able to lose a few pounds, after a few months, most, if not all of the weight eventually was gained back. And it seemed as if every time CM tried a new diet, there was some initial weight loss, but then at the end, over the long run, she seemed to have put more weight on. She had consulted with various nutritionists and had a personal trainer at one point. And with the combination of diet and exercise, she ended up feeling fatigued most of the time and began to develop other problems as a result of excessive exercise. Uh, it goes without saying that in her case, although she had tried and made a valiant effort with exercise, it really didn't help in the long run for helping her to manage her weight. As I said before, she had tried various types of exercise. She had tried resistance training. She had tried a long distance endurance training. In fact, not long ago, she even completed a half marathon, and still the weight continued to be a challenge for her. As I mentioned before, as a result of chronic diet and exercise, a syndrome of yo-yo dieting and exercise, I'll call it, she began to have flare-ups of some chronic inflammatory conditions that she had experienced at one time or another in the past. One of the problems she began to develop was a condition called rosacea, which is basically a type of skin infection that affects the face, the cheeks, and the nose in particular. She also began to have flare-ups of irritable bowel syndrome, and this, of course, certainly limited her to the amount of exercise that she could do, particularly when exercising outdoors. So her story has many features that we can relate with, being busy with our work, our families, struggling with weight gain, trying and failing various diet and exercise regimes, and in the long run, really having little or no to show uh, despite all this effort. Well, to give you an idea of the kind of transformation that's possible with intermittent fasting, I want to show you a before and after picture of CM. And these pictures were actually not that long ago. So first of all, let me share with you a picture of CM from December of 2010. And here she is, a little bit more than 200 pounds, and her height is actually about 5'4". So she had, at least according to various charts, problems with her weight, at least from a body mass index perspective. Um, Here's a picture of her more recently, March of 2012, and you can see a pretty remarkable transformation there. One of the questions that most people ask who know CM is how did you do it? And I can begin by telling you what she most definitely did not do. What CM did not do was begin any form of crash dieting. She did not do any form of excessive exercise. She had no forms of surgery. There was no lap band or any sort of gastric bypass surgery. And she was not taking any over-the-counter fat burner supplements, nor was she taking any prescription medication specifically for weight loss. So she wasn't on any stimulants or any appetite suppressants during this time. Most of the efforts, in fact, the majority of her efforts really came through intermittent fasting and combining it with a number of nutrients that I'll talk about in just a minute. So, how she transformed herself was, again, really quite remarkable. She did this, as I mentioned, through the protocol that is the topic of this webinar, intermittent fasting. And she began it again about now close to 20 months ago. And you can see already what kinds of transformations have continued. There were some nutrients that she used, and there was another type of exercise. It's really not anything new, but it was an idea of strategically timing her exercise while she was fasting. Well, I have to be honest with you and tell you that the reason why I know CM so well is that she actually is my wife of 25 years. I have seen and witnessed all of these transformations with my own eyes, and I can tell you that she deserves the credit for this transformation, certainly. But she also knew that I was very interested in how nutrients affect the brain, and it wasn't until we really had a long discussion about changing her focus, not from losing weight, but from the perspective of improving her overall health, where we began to see the transformations occur. So, what is intermittent fasting? What does it really mean? I mean, is it simply just a period where you don't eat and then gorge out? Certainly not. Intermittent fasting is a pattern of eating that alternates between predetermined and strategically timed periods of fasting and non-fasting. It has a very interesting history, and it really evolved from early studies back in the 20th, earlier this century, where a protocol called caloric restriction was examined. And caloric restriction, as the name implies, is a protocol by which animals, and usually we're talking about mice and other experimental animals, are fed a diet that's slightly below their metabolic requirements. And a number of interesting things happen over the long run. Uh, Caloric restriction has been examined in humans, and indeed there are many groups existing today that continue to practice caloric restriction. But the problem or the challenge is that it's not very sustainable over the long run. And so intermittent fasting was really proposed as a strategy, an alternative strategy for obtaining the same kinds of benefits that you would see with long-term caloric restriction. The difference, of course, is that with intermittent fasting, as the name implies, you do break the fast at predetermined periods of time. What's common, or what I think the most important point to understand about intermittent fasting is that the focus is on when to eat, not on what to eat. So a common question that comes up is, what do I eat, and what kind of diet I follow? And I'll give you some advice about that, but I want to start off by saying it's really a focus on timing rather than on nutrient composition. Although I will tell you that, again, the intermittent fasting and caloric restriction do not encourage you to go out and binge. And that reminds me about another point. If you have ever had a problem with any sort of eating disorder, intermittent fasting and caloric restriction are probably not going to work for you. The other thing that I would mention is that if body composition or weight loss is one of your goals, as it is, I imagine, for most people watching this webinar, I have to tell you up front that intermittent fasting, at least the evidence that is available now, is no better than any other traditional routine of diet and exercise. It does have some advantages, in my opinion, but there really haven't been enough studies that look at intermittent fasting in humans and compared it to traditional diet and exercise. So just by my own experience and in my experience in researching and observing what this has done, the weight loss is there. It does take work there. It is not a magic bullet. Uh, the timing of meals optimizes how our bodies were evolved to metabolize nutrients. And what I mean by that is that if you think about it for a second, for most of our time as a humanoid species on Earth, we have not had three square meals. It was very often the case that we would go for periods of feasting and then through periods of famine. And this is simply a result of the fact that we were a hunter-gatherer species and we had to hunt down our food. And when we were unable to capture our prey, we simply didn't eat. So intermittent fasting, in a sense, is really closer to the way that our bodies were evolved to store nutrients. That is to say, we weren't always constantly fed, and our bodies over evolutionary time became very effective at storing fat and using available energy sources such as glucose. So when we begin to practice intermittent fasting, we really begin to shift our metabolism to a way that it was evolved uh, to run optimally. Well, let me tell you about some of the benefits of intermittent fasting, because after all, this is the reason why we would want to do this. So, a number of studies have shown that both caloric restriction and its variant intermittent fasting have resulted in a number of positive health benefits. These include reduction of blood pressure, reduction of blood lipids or blood fats, and importantly, a reduction in inflammation. And what I mean by this is a reduction in inflammatory markers that are in our body that indicate chronic inflammation. There's a group of chemical signals in our body called cytokines. And some of these cytokines increase inflammation and others decrease inflammation. And what's been shown in both caloric restriction and intermittent fasting is that our body's ability, or I should say our body's production of these inflammatory cytokines is significantly reduced while intermittent fasting or practicing caloric restriction. And this in turn results in a number of other health benefits. What's increased during intermittent fasting are fat burning, which is obviously a good thing. Also increased is the production of growth hormone, and also, and this may be somewhat paradoxical, an increase in our metabolic rate. And here it is where we begin to see slight differences between caloric restriction and intermittent fasting. You see, with caloric restriction in the long run, sometimes what is observed is that individuals have a decrease in their basal metabolic rate. Well, with intermittent fasting, we really don't see that. In fact, in the short term, metabolic rate has been shown to increase slightly. So increasing metabolic rate while fasting is certainly possible as long as the fast isn't any longer than, say, 36 hours. Another group of improvements that we see are obviously better control of appetite, and this occurs largely as a result of the fact that we get better at distinguishing between physiologic hunger from psychological craving. And as we begin practicing intermittent fasting, we tune in to the subtle cues in our body that tell us that we should eat. And with some mindfulness applied, we can really begin to tease out what a psychological craving is from a genuine signal of hunger. So intermittent fasting, as I'm proposing it today, really does help us to regulate our appetite over the long run simply because we're better tuned in to cues both in our body as well as in our environment that tell us about when to eat. Another interesting feature about intermittent fasting is that it improves blood sugar or blood glucose. In studies that have been done on intermittent fasting in just about every species examined so far, we see improvements in energy utilization and efficiency in glucose uptake. So with humans, we know that short-term periods of fasting have been associated with better blood glucose control. Another area of benefit is in this brain process called neurogenesis. And neurogenesis is simply a term that we use to describe our brain's ability to generate new neurons and new connections between neurons. Uh, Anytime we subject our brain to just a very slight stress, whether it's a stress induced by hunger or a psychological stress, there is evidence that sometimes our brain responds to this stress in a positive manner by the production of certain growth factors like brain-derived neurotrophic factor, or BDNF for short. And the point is that with just as with the slight stress to a muscle and how we know how stressing a muscle slightly can induce growth, so too can fasting induce a slight stress to the brain that encourages the production of new connections among existing neurons. So neurogenesis is something that is, or I should say, has been observed with animal models of intermittent fasting. I think mice are probably the most studied species. Uh, we have yet to see definitive evidence that neurogenesis is increased with intermittent fasting in humans, but a similar process occurs with aerobic exercise, and we know very definitively that aerobic exercise increases both neurogenesis and neuroplasticity in certain parts of the brain. And it's believed that aerobic exercise is another form of physical stress, is very similar to the kind of mild stress that is introduced by intermittent fasting. So what are the variants of intermittent fasting? So there are variants of intermittent fasting, and what's interesting about these variants is that they all allow for a different feeding window or a different period of time during which you're allowed to consume a healthy diet. Let's take a look at some of these variants. So one of the first variants of intermittent fasting was something called the alternate day diet or alternate day fasting. And in this variant, what occurs is that someone begins the fast with a 36-hour period of not eating. And after 36 hours, there is allowed a 12-hour feeding window. And during the feeding window, people are encouraged to adopt a relatively nutritious diet. There are many different types of diets you could select from, but the idea here is that it's a nutritionally sound diet. What the 12-hour feeding window is not is a period in which you can binge and eat anything you want to. It's certainly not how intermittent fasting works. So you want to resume feeding with a nutritionally sound meal during any of the feeding windows that I'm going to be mentioning in a second. And in this variant, you simply omit 1 or 2 meals a week. Now that may not sound like much, but over the long run, it certainly can introduce the health benefits that we've seen with intermittent fasting in the short term. It's a form of intermittent fasting that's popular among those of us who are familiar with the paleo diet. In the paleo diet, people are recommended to follow a nutritionally sound a nutritionally sound diet of unprocessed food, and they're also encouraged to randomly skip meals, again, maybe once or twice a week. And the idea here is that this more closely mimics the timing and pattern of our meals as we were evolved for most of our life as a humanoid species on Earth. Eat, Stop, Eat is another variant of intermittent fasting. And in this variant, the idea is that during any given week, you have 1 or 2 24-hour fasts. Now, again, the timing on the fast does not have to be exactly 24 hours, but it has been shown that to obtain most of the hormonal benefits that we see with a short-term fast, we see that within the first 18 to 36 hours. So with the Eat, Stop, Eat protocol, you're encouraged to pick 1 or 2 days, non-consecutive days, and fast for 24 hours. And that's really all it takes, is just one or two to see the kinds of improvements that I mentioned earlier. Lean gains is yet another variant. Lean gains is more geared toward the bodybuilding community, or people who are very interested in improving body composition. And in this variant, you have a 16-hour fast followed by an 8-hour feeding window. What makes lean gains a little different from the other protocols I've mentioned up to this point is that in the lean gains protocol, you're encouraged to follow a high protein diet, and you're also encouraged to exercise, specifically weight train, toward the end of the 16-hour fast. And the reason for that is that you take advantage of the increases in growth hormone that occur toward the later stages in the 16-hour fast. So again, what distinguishes lean gains is, number one, the specification of a relatively higher protein diet, and the technique of adding resistance training toward the end of the fasting window. This is not too different from another variant called the warrior diet, in which, again, there is a short fasting period. Again, by short I mean less than 1 day, and you follow this by a 4-hour feeding window. Let me give you an example of an intermittent fasting protocol so you can appreciate what it looks like. So with my patients, and certainly the protocol that May followed, May, my wife I introduced you to earlier, was we had a period of time where we gradually eased into the fast. And that's an important point. No matter which of the variants you choose to follow, it's really important that you allow your body some time to adapt to the changes that are occurring. There's a lot of reasons for this, but psychologically, if we go from a period of time where we're eating 3 square meals a day or multiple meals per day to restricting our eating window to something like 4 hours, our body, and our brains for that matter, can sometimes go into a panic mode. And we don't want to do that. And the way that we ease into the fast is by doing what I'm calling an induction fast. And during the induction fasts, which typically last for a period of 2 weeks altogether, what you do is you limit your meals to 1 8-hour window during the day. So in other words, you are allowed to eat every day between noon and 8 p.m. Again, I would repeat, that is every day. Now, most of you may be thinking, well, I already do that anyway, but it actually is, the idea here is you want to be mindful of the signals of hunger that are occurring during the time that you are not eating. In other words, any time after 8 p.m. until noon the next day. And what you want to do is begin to listen to your body and begin to appreciate clues of hunger versus cravings, and really learn to distinguish those cues and respond appropriately. So the induction phase is just a way of easing into the fast, and I typically recommend that you do it from noon to 8, since that's a period of time that is very flexible and is very adaptable, particularly for those of us who are away from home during the day. The induction phase of 2 weeks is followed by a maintenance phase. And during the maintenance phase, what we begin to do is to gradually reduce the time of our feeding window. So what I recommend is that our feeding window get moved down from, say, 8 hours down to about 4 hours. And again, this could occur gradually. You don't have to go from 8-hour feeding window to a 4-hour feeding window. You can do this by going from an 8-hour window to maybe a 6-hour window 1 week, and then the following week go down to the 4-hour window. What's important during the maintenance phase is that, number one, you already be an expert, if you will, at distinguishing between physiologic hunger and between physiologic hunger and cravings. And what you also want to do during the maintenance phase is gradually begin to practice What you want to do during the maintenance phase is begin to practice. Let me pause here again. So during the maintenance phase, we limit our meals to 1 4-hour window. In this case, I'm recommending sometime between 6 and 10. And again, I would emphasize that there's flexibility here. Your feeding window could occur anytime. It's just that I found in my work with patients that the 6 to 10 p.m. time works best for having a social life. So you can go out with friends and family out to dinner, attend a party in the evening, if you will, and still appear to not be dieting. So what the intermittent fasting protocol during the maintenance phase allows you to do is to more or less resume a normal social lifestyle. What I recommend during the periods of fasting is to consume some form of liquid. You do not want to dehydrate yourself, and strictly speaking, during our fasting periods, we are allowed actually to consume caloric beverages. So coffee may be consumed, green tea is a good choice, fiber supplements, particularly psyllium and methylcellulose, and then another supplement that can be consumed is something called branched-chain amino acids. And I'll talk about those more in a second. But the idea here is that you are allowed a certain amount of calories that may come through any of these forms of nutrients. Well, one question that often people ask is, what can I eat during a feeding window? And I've mentioned several times before that you do not want to make this into a binge. The type of diet that generally works best is a diet that has a higher percentage of macronutrients that are coming from protein and fat. What do I mean by that? Well, you'll see in this graph here of various diets that are listed to the right that all diets vary in terms of their macronutrient composition. Some are higher in protein, others are higher in carbohydrate. In this particular graph, which is taken from a study published in 2008, we can see that there are various types of macronutrient compositions. We could see to the far left, for example, that the Ornish diet has a relatively high percentage of carbohydrates. If you go to the extreme right of the diagram, you can see that Atkins is at the other end of the spectrum, and Atkins, as many of you know, is generally described as a high-fat, high-protein diet. It's sometimes also known as the no-carb or low-carb diet. Generally speaking, what I recommend for the diet that should be followed during the feeding window is something that lies along the right end of the spectrum I'm showing you here. So this would include diets such as the Mediterranean diet, the Zone diet, the South Beach diet, and the Atkins diet. So these are all reasonable choices. There's nothing that says you can't do Ornish or a DASH diet, but the point is that in studies that have been done thus far with regard to weight control over the long run, the diets that have a relatively lower percentage of carbohydrates coming from as macronutrient sources seem to do better in the long run. So again, this answers the question of what type of diet to follow, and I generally tell most people to follow something like Zone or Mediterranean. Just one other side note on this. If you are already exercising, or if you plan to exercise during intermediate fast, I would not recommend that you begin with a low-carb diet such as the Atkins diet at the beginning. Again, you want to give your body a chance to get used to the sensation of intermittent fasting. But another thing is that trying to do endurance or resistance training on a low-carb diet can be very challenging. So although it's possible to do, I'd recommend that at least in the early stages, and at least for the first few months, you not follow that type of diet. Well, another key strategy for the type of intermittent fasting that I'm recommending is the use of key nutrients. And the first nutrient I recommend is use of fiber. And the dose is anywhere from 3 to 5 grams twice daily. The second supplement, or the second type of supplement I recommend, is the use of healthy fats. And the healthy fats are omega-3 fatty acids and medium chain triglycerides. Both of these have a very well established use in the medical literature for various types of ailments. Omega-3 fatty acids are recommended at a dose of 2 grams twice daily, and medium chain triglycerides are recommended 15 grams twice daily. People have heard of omega-3 fatty acids. We know those as fish oil. People many times have never heard of medium chain triglycerides, but there's a very common source, and this is a source that I recommend, and the source is coconut oil. Coconut oil, whether it's refined or unrefined, is a very good choice for obtaining medium chain triglycerides. And then finally, the third key nutrient that I recommend for intermittent fasting is the branched chain amino acids. And here I'm recommending a dose of between 10 and 15 grams twice daily. So people will sometimes ask, does it matter during, can I use these supplements, do I have to use them during my feeding window, or can I use them during the fast? And the answer is, it really is up to you. I find that branched chain amino acids are particularly helpful during the fasting period because they have a number of benefits, which include the reduction of hunger, and they also help to stabilize blood glucose. We're going to talk about all of these supplements in more detail in just a second, but the purpose of this slide is just to introduce you to these three key nutrients and the doses that I'm recommending. So fiber and intermittent fasting. It turns out that in the average American diet, we are under-consuming fiber. For adult healthy males, the general recommendation is about 30 grams of fiber per day, but the actual adult male consumes much less than that. That's unfortunate because fiber has a number of beneficial effects that include slowing the absorption of glucose. You see, anytime we eat a meal, our intestine is involved in a number of physiologic processes which regulate the absorption of sugar or glucose from the meal that we eat. When you take fiber, when fiber is present in the digestive tract, this effectively serves as a sponge for absorbing glucose and slowing down the release of glucose into the circulatory system. And when this happens, you avoid those insulin spikes that we sometimes see in response to sudden and dramatic rises in glucose. So another benefit of fiber is that it contributes to the sensation of fullness via gut hormones like GIP and GLP. And what these hormones do is they signal the brain that it's time to stop eating. And it's simply in response to the mechanical distension of having more food, or I should say the mechanical distension of the gut. You see, one of the things that fiber does in the presence of water is it expands, and this expansion also leads to greater volume, and the greater volume in turn leads to the secretion of these hormones that tell the brain that it's time to stop eating. Well, where can you get fiber? What kind of sources do I recommend? The two sources that I recommend are either psyllium husk, and one example of that is a product called Metamucil, and another source of fiber is methylcellulose, otherwise known as Citracel. Both of these are very excellent sources of fiber, and regardless of which one you choose, I recommend taking anywhere from 3 to 5 grams twice daily for a total of about 6 to 10 grams. I've included a picture of two of the fiber sources. You see on the left Metamucil, on the right Citracel. There are some differences among the two. For one, Metamucil, as psyllium, is fermentable. That is to say, for some people it can cause gas and bloating because gut bacteria do take psyllium and ferment it, and in the process of fermentation cause gas. that can be a problem for some people. And if it's a problem, I'd recommend using Citracel, which is the form of fiber that is non-fermentable. I told you earlier that healthy fats were also a key component of an intermittent fast. The dose of healthy fats, again, that are recommended are omega-3 fatty acids, fish oil, 2 grams twice daily, or the medium-chain triglycerides in the form of coconut oil, and the dose there is 15 milligrams twice daily. What I typically recommend for medium-chain triglycerides is that they be used at the beginning of a fast and at the very end of a fasting period. Healthy fats will accentuate intermittent fasting by inducing the production of ketone bodies, which can be used as an alternative energy source by the brain and the muscle. They also reduce hunger, as I mentioned before, and finally, because the supply of energy to the brain is never compromised, they can contribute to improving mood and cognition. Here's a sample of two types of fish oil. On the left you can see the fish oil capsules, and on the right the fish oil. This is a brand called Nordic Naturals. Again, there are many other high quality fish oils on the market, but these are two that I use most often. There are differences, again, as we saw with the fiber before. With the capsules, you have to read the label. 2 capsules of this particular type of omega-3 only equals about 700 milligrams of fish oil. So in order to get 4 grams a day, you would need to consume somewhere around 7 to 8 capsules per day. By contrast, if you decide to go with the oil, you would only need about 1 tablespoon per day. That 1 tablespoon would contain close to the 4 grams of omega-3s that I'm recommending. So the benefit of the capsules is, of course, it's not an oil and it travels well. Whenever I travel, I tend to rely more on fish oil capsules, and when I'm at home, I use the oil. I mentioned coconut oil as a source of medium-chain triglycerides, and here are just two types of coconut oils that I've used in the past. On the left, we have the Spectrum organic coconut oil, and on the right, we have extra virgin coconut oil from a manufacturer known as Jarrow. There are differences, again, in coconut oil, so I encourage you to read your labels. The main difference between the two that I'm showing here is the one on the left, the Spectrum, does not smell or taste like coconut. In fact, it has a very clean taste, if you will. It's not, it's very light. Whereas the one on the right, the Jarrow formula, does smell like coconut. Again, there's no problem with that, but sometimes you just get tired of having the coconut flavor in your mouth. So sometimes, just to change things up, I'll recommend using the organic coconut oil, which does not have any flavor. Finally, the branched-chain amino acids. What are they? Well, the branched-chain amino acids are a subtype of amino acid. And as many of us already know, amino acids are the building blocks of protein. Amino acids occur in nature. There are about 20 occurring in nature. And 9 of these amino acids are absolutely essential to the diet of human beings. What I mean by that is that we cannot produce certain types of amino acids that are essential for our bodies to function well. Among the 9 that are essential, in other words, among those that we must obtain through our diet, are leucine, isoleucine, and valine. And leucine, isoleucine, and valine collectively are known as the branched-chain amino acids. They have a number of beneficial physiologic effects. One of the things they do is they maintain muscle mass while dieting. Another thing that the branched-chain amino acids do is they reduce hunger and work to balance blood sugar. And the way they do that is that the body can take the branched-chain amino acids and convert them to glucose. Now, this actually involves transformation to other intermediary amino acids called glutamine and alanine. But the point is that it's not too taxing metabolically for the body to take branched chain amino acids and convert them to glucose when glucose supplies are low. Another interesting feature of the branched chain amino acids is that they've been shown to cause weight loss by signaling mechanisms to the brain and adipose tissue. Here are two forms of branched chain amino acids. On the left, the rapid drive BCAA 5000 that's available at GNC. And on the right, we have a brand known as modern BCAA, the better BCAA, as the label says there. I can't vouch for whether it's any better, but I can tell you that it is also a form that I sometimes recommend. Now, what's the difference between the two? Well, again, they're both branched chain amino acids. They both have leucine, isoleucine, and valine. One difference is that the pure form of branched chain amino acid has a very bitter taste. And another feature is it doesn't mix very well in water. So as a workaround, I sometimes recommend the flavored branched chain amino acid that is pictured on the right. Now the disadvantage is that it is not a pure form of branched chain amino acid. There is, after all, some flavor additives. It's sweetened with sucralose, and there's a couple of, I believe there's a couple of other additives. But the point is that the modern form, the one in the white, tastes better, and it also mixes better, especially when used with lukewarm water. So these are not the only two. There are many other types of branched chain amino acids on the market, but these happen to be the two that I most often recommend. Okay, so what about the role of exercise in intermittent fasting? Well, it turns out that in the long run, exercise alone is not effective for long-term weight management. There's a lot of reasons for that, but several include the fact that when we exercise, we have an increase in our compensatory eating. In other words, our bodies and our brains sense the energy fluctuations, and through complicated mechanisms, we have our appetite increase in order to compensate for the additional energy that we expended during exercise. Another thing that happens is that there's an overall reduction in our daytime activity when exercise is introduced as part of a lifestyle change. So people who have exercised regularly will sometimes report that during the times of day when they are not exercising, their baseline activity levels will go down. And that, in a sense, is the body's mechanism for preserving energy. We know that exercise also increases the stress hormone cortisol, and if our goals are better body composition, we know that excessive exercise may actually be counterproductive, because if we exercise excessively, levels of the hormone cortisol tend to remain elevated longer than they should, and this in turn leads to difficulty with weight loss. Another factor to consider is that exercise can lead to repetitive use injuries. And the simple fact of the matter is that if we are injured as a result of excessive exercise, then we are not as active as we normally would be, even during the times we're not exercising. People have often asked about what type of exercise I recommend for the fasting periods. And what I often will recommend is really quite simple. What I recommend are leisurely walks of about 30 to 60 minutes per day. Now, during the maintenance phase of an intermittent fast, that is to say, after having done an induction fast for a period of at least 2 weeks, I recommend that daily walks be included in addition to resistance training, weight training, 2 to 3 times per week. Why do I recommend resistance training? Well, resistance training has a very important role. One of the things that it does is it preserves muscle mass during periods of caloric restriction. You see, when our bodies, being the highly evolved organisms that they are, sense that there is not enough calories coming in through the diet, the body will begin breaking down tissue in order to feed itself. And during extended periods of caloric restriction, it's been demonstrated that we are more likely to lose muscle mass as our bodies attempt to basically feed itself by breaking down muscle tissue. Another important role of resistance training are the improvements in lean body mass. Obviously, lifting weights and doing resistance training preserve muscle mass, and they also improve blood glucose. The reason for this is that our muscle tissue is one of the most important mechanisms we have for regulating our blood glucose, since our muscle tissue, along with liver, is an area where we can store glucose, and therefore the liver and muscle have a very important role in maintaining and balancing our blood glucose levels. Finally, a third benefit of resistance training is that it can increase growth hormone that is already induced by the intermittent fast alone. So we're capitalizing on our gains from the intermittent fast by adding resistance training toward the end of the fasting window. This is a study that takes a look at the effects of resistance training versus aerobic exercise and looks at effects on lean body mass. This is a study that involved 20 people. It is rather small, but what was interesting about this study is that it very clearly shows that lean body mass is sometimes lost and resting metabolic rate is decreased when the diet is combined with aerobic training. And you can see that in the graph represented here. Now, in the resistance training group, there was not a loss of lean body mass. In fact, lean body mass was preserved in the resistance exercise group, and resting metabolic rate was increased. So the point of this study was to demonstrate that resistance training may have a superior role when efforts are made to preserve lean body mass. The other point that should be mentioned about this study is that in both groups, the aerobic exercise group and the resistance training group, calories in each group were held steady. They were each following what is referred to as an isocaloric diet of 800 calories, which is not a lot, but the point of holding the calories steady was to demonstrate what effects the variable of exercise would have. Another concept that I introduce when intermittent fasting is this idea of strategically timed exercise. And strategically timed exercise is exercising in such a way as to optimize the hormonal and anti-inflammatory effects of intermittent fasting. I recommend leisurely walks done during the beginning of fasting periods, primarily to reduce cortisol. Now, the walks can be done at any time, but preferably I recommend at the beginning. The other point I would make is that these are leisurely walks. These are not power walks or hiking vigorously or even jogging. You want to keep the walks at a pace that is relatively low. It would be a pace at which you could have a conversation with someone without even pausing for your breath. Resistance training done toward the end of the fasting period, by contrast, is better to increase the production of growth hormone that's already been induced by the act of fasting itself. And as we learned earlier, one other effect of resistance training is that it can increase our muscle sensitivity to the presence of blood glucose. So let me just summarize what we've talked about. What I told you was that intermittent fasting is associated with a number of health benefits that include improved blood glucose, improved growth hormone, and improvements in fatty acid oxidation or fat burning. Some of the health benefits of intermittent fasting are optimized when it's combined with key nutrients like fiber, healthy fats, and the branched chain amino acids. The health benefits of intermittent fasting can also be improved by using strategically timed exercise such as leisurely walks at the beginning and resistance training once your body has adapted to intermittent fasting. I'd like to end with the Ayurvedic proverb, which summarizes very nicely many of my experiences in working with diet as a intervention for the treatment of disease. When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. So I'd like to thank you at this point for joining me on this webinar. And before you go, I'd ask you to do just a couple of quick things. First of all, if you haven't already done so, please visit our Facebook page, BrainMD. That's www.facebook.com/BrainMD. And please like us on Facebook. By doing so, you will get a daily update on the latest in nutritional and exercise science right into your Facebook feed. If you'd like, you could also follow us on Twitter, and we are at Michael Lara MD. Finally, if you'd like information on private one-on-one nutritional counseling or coaching, please visit our website at www.mlaramd.com. Thank you for joining us on this seminar, and I hope to see you soon.